Hello, I am Dr. Frederick Beavers, and this is a Society for Vascular Surgery briefing about the topic of diversity in vascular surgery. This is an exciting time to be a vascular surgeon, and even more so to be an American. The demographic shifts that have taken place in America within the last 20 years have exacerbated the difference in the number of minority physicians versus the percentage of minority Americans. The population projections to the year 2050 will only widen the gap. This can be seen as a problem or a prime opportunity to address some of the healthcare disparities that are so well documented. The higher incidence of lower extremity amputation and stroke rates in African Americans and the higher incidence of diabetes in Hispanics and Native Americans are a few areas of noted differences in comparison to the Caucasian population. Outcomes for the treatment of lung cancer and coronary artery disease have shown to be worse in minority populations. The receipt of appropriate diagnostic tests for cancer or the usage of analgesics has been found to be dissimilar in different patient populations. Research has shown that healthcare disparities has many contributing factors: lack of access to the healthcare system due to no or inadequate insurance, poor compliance to recommended health treatment, and not implementing practice guidelines in certain segments of the patient population are a few areas that have been studied. One area that has been noted to be consistently deficient is the low number of minorities entering the healthcare field. Obviously, this limits the pool of candidates for surgery and its subspecialties. This becomes important when trying to address disparities. The impetus behind increasing the number of minority physicians is that a diverse group is more likely to generate different ways of addressing a problem. Also, studies show that minority patients tend to identify minority physicians as their primary care physician. Minority physicians tend to practice in underserved areas. These facts, along with the higher prevalence rates of peripheral artery disease risk factors in African Americans, Hispanics, Native Americans, and other minorities, along with the aging of the population, open an opportunity within the field of vascular surgery. Vascular surgeons will be in increased demand in the future to care for these patients. Our dual skill set will come in handy. Because minority patients have higher rates of medical comorbidities, minimally invasive approaches to vascular disease will be of benefit, but standard open approaches will be needed as well. Equally important, our recognition of differing procedural outcomes amongst the patient populations that we treat will lead us to rethink the doctor-patient relationship. This is an area where we can have a direct impact. Steps are being taken to promote diversity within the vascular community. During our annual vascular meeting in 2008, for the first time, this topic was discussed amongst the general membership. Projects to broaden our membership have been implemented, such as outreach to minority medical student organizations and the offering of scholarships to attend the vascular annual meeting. The goal is to reach students and residents who would not ordinarily consider vascular surgery as a career. Among them will be minority students and residents who in the future might develop ways to impact the known healthcare disparities that exist. This is a goal of our society. After all, to quote our President, Barack Obama, there is not a Black America and White America and Latino America and Asian America. There is the United States of America. This briefing is made possible by a grant from Cook Medical. To learn more about diversity in vascular surgery, visit vascularweb.org.